Hi, this is Dr. Balanoff, and this is Dentistry Goals. I want to spend some time talking about something that's frustrated me as a dentist so much that I used to cringe when I used to see those poor patients on the schedule. And most of them were all nice, and I still saw their names on the schedule, and I still cringed. And what are they? There are full upper and lower denture patients. Oh my gosh. So let's kind of talk about all the stuff that I did and all the different iterations that I did from the time that I left dental school until the time I treated my last denture patient. I was so OCD over trying to make the best possible impression. I would make custom trays. I would border mold with compound, with two different color compounds. I would use a ZOE, zinc oxide eugenol wash. Sometimes I would wash it twice. I would put escape little holes within my trays to make sure there was no tissue compression when I took the final impressions. I sometimes would even make processed try-in trays and then reline those before I actually processed the final denture. I would try the teeth in. I tried flat plane teeth. I tried lingualized occlusion. I tried 12-degree teeth. I tried everything that you can possibly do. Sometimes I would insert the denture, and then after I inserted the denture, I would use a co-soft reline material and allow the patient to wear that, and I would change it out every single week for the first month, and then I would do a hard reline after 30 days of co-soft relines, trying to make the best possible denture I can get with the maximum amount of retention and the most perfect occlusion that anyone's ever seen in their entire life. And at the end of the day, my biggest problem was this thing called shrinkage polymerization of the methyl methacrylate acrylic used to make dentures. Because no matter how well I did it, that polymer was shrinking when it was curing. And the moment that it shrunk, it pulled away from the tissue. And no matter how thin that material is, it pulls away from the tissue. And on my best day, if you're truly, truly honest with yourself, because we like to think that we've got this perfect mucostatic impression, and we've border molded the living daylights, everything, and we've taken into consideration frenums, and we've done everything we can possibly do. That denture is not touching the tissue equally all the way around. So what happens next? Well, I had the most wonderful experience this week. I travel out to Scottsdale, Arizona, and I spend 2 days with the team at AvaDent. And AvaDent is a company that makes dentures, and they do it all digitally. And they mill it out of a puck of acrylic. And I'm going to kind of explain the steps to you right now. Now, I have no financial interest in AvaDent. AvaDent's not paying me to even brag about what they do. What I'm bragging about is the advent of digital dentistry and where digital dentistry is going with respect to prosthetics like dentures, partial dentures, or hybrids. In my opinion, AvaDent is the leader in this technology, and I don't think anybody out there can touch the system of what they do. So let's talk about the way that we make a conventional denture. So we get the rims, whatever impression technique you want to use, whatever material you want to use. You finally get a master cast. They make bite rims on the whole entire thing. We put the bite rims inside the patient's mouth. We do the try-ins. We do the bite relations. We do a wax try-in. The patient loves it. And now we're going to process it. So everything is in wax. And if you remember from dental school, if you've ever processed a denture, the denture goes inside stone, and then we put some separator on there. We pour another layer of stone. Then we put that brass container inside boiling water. We pull about the 2 halves. We melt away all the wax. And what are we left with? We're left with a void inside plaster and denture teeth that are left behind. So now we may use some bonding agent on top of the denture teeth, or we may kind of grind them with a burr. And then we're going to put a separator inside the plaster. And then we're going to mix up the methyl methacrylate acrylic, and whether it's Lucitone 199, 199, or another brand, we're going to mix it all up. But I used to love using Lucitone 199 because I was told that was the best. And then we mix it all up, and then we pack it inside the flask, and then we squeeze it all together, and we trim away the excess. And then we put some more inside there and squeeze it all together and trim away the excess. And we may even do it a third time. So now we've got this void filled with pink acrylic. And now we're going to squeeze those 2 halves together, and we're going to put it inside a hot water bath. And depending on how you want to do it, whether it's a slow cook or a fast cook. I was more of a slow cooker. I would cook my acrylic for 9 hours at about 170 degrees because I knew that the slower I cooked it, the less shrinkage polymerization would occur. I would deflask the denture. I would polish it all up. And I'm thinking this is the most amazing thing I've ever seen. And I would put it inside the patient's mouth. And if it was a top denture, it would sometimes just drop to the floor of their mouth. And then I'd have to reline it. And I'd have to go through all of this stuff again. So where are the inaccuracies coming? Well, the inaccuracies are coming not so much from my impression, because that was pretty darn accurate. The inaccuracies were coming in all the laboratory work that followed the impression. So we're adding wax to the master model so I can have a bite rim that can come on and off, especially if there's undercuts. And then I process it. And for as good as I can process it, I could never get away from that plastic, that polymer from shrinking. And remember, when it shrinks towards the largest mass. So it's pulling away from the tissue and it's going towards the bulbous of the acrylic, which is typically around the anterior portion of the teeth in the front, or the majority of the acrylic, which is, underneath the teeth in the back. So it's pulling away from the palate. And that's like the last place I need things to be pulled away from, because I spent all this time establishing this amazing post stamp. And all of a sudden, the plastic doesn't touch the tissue in the back. And now I have to reline it. And even if I ground the model to create a really strong post stamp, it was a very arbitrary thing. So I would cut the post stamp in using a number 8 round burr. I would go ahead and I would score the model to try and get even more pressure on the posterior palate to create an amazing posterior palatal seal. And after I did all of that stuff, I still wouldn't get the kind of seal that I thought I was supposed to get. And worst of all, if I made it too deep, I'd have to worry about causing the patient to have a sore spot. And now I'm grinding it away, but I'm grinding away the acrylic on a sore spot. Now the sore spot heals, all the swelling goes away, and all of a sudden the denture no longer fits the tissue, and I'm back to square one. I know you're feeling my pain. All of us, if you've done enough dentures in your life, have experienced all of the horrible things that I'm talking about. And this doesn't even go to start to address what type of occlusion we're giving these patients. And it doesn't even talk about all the linguistics that we have to try and figure out along the way, making sure we got the teeth set in all the right place. So what does AvaDent do that's so unique and amazing? Well, first of all, everything they do is digital. So when you take the impression, you have two choices. You can either scan that impression, or you can send it to them and they're going to scan it. Yeah, they're not working off of a stone model, because the moment you pour stone into that impression, that stone is going to change its dimension from what the impression was. So if you can scan it, now it's exactly what the inside of your impression is. And then once they've got that digital scan, they're able to mill out a piece of plastic, which is the exact fit of your final impression. So just imagine that they've got a puck of acrylic and they've got a little tiny drill hooked up to a computer. And that little drill removes away all the plastic that's not associated with the tissue and what you want out of this whole entire thing. They create the perfect bite rim for you. And then they're going to return that to you with wax, or they can return it to you with some teeth set up on it if you want, depending on, the technique that you want to use. But let's just say they return it to you with wax. So now you're going to try that wax rim in place. You're going to go ahead and you're going to make the incisal edge, and then you're going to have the person smile, and you're going to figure out what's the, maximum smile. You're going to make a note on that. You're going to make a note of the midline. And then if it's a maxillary denture, you're going to worry about the allotragus line. If the lower arch is edentulous, if not, you're going to go ahead and match to the bottom, and you're going to make sure the vertical dimension is exactly where you want to do it. And then this company is going to go ahead and place the teeth in wax. They can return it for you for a wax try-in if you'd like, and a lot of people like that. Some docs will go straight to the final. So let's just pretend they do it as a wax try-in. They return it to you, and now you can move the teeth around if you want. But here's the amazing thing. When you move the teeth around, you can move the teeth around on the computer. You can move it around on the wax too if you want, but you can move it around on the computer. So if you want to have the lateral incisors kind of kicked out and overlap the central incisors on the distal of the central incisors, you can do that. If you want to have the canines with a little bit more angle to it, you can do that. If you want the centrals to be a little longer in relationship to the laterals, you can do that. You can just go on and on and on and on and on and adjust everything you possibly want to adjust, and you do it all on the computer. All of this gets sent back to the company. And when they get ready to make your final denture, they're not setting up denture teeth, and they're not processing acrylic by boiling out wax and processing it against a master model. What they're doing is they're taking all the digital information that you've provided them, and they're going to take a hard piece of pink acrylic, harder than anything you've ever had, and they're going to mill it out so that the acrylic intaglio surface touches that tissue so perfectly, like nothing you've ever seen. So if you're still doing dentures the old-fashioned way with analog techniques, making custom trays, taking a wash impression, and then pouring that in stone, and then making bite rims over the top of that stone, and then mounting all of that stuff, and and it goes on and on and on and on and on, as opposed to doing everything digital, you're wasting a lot of time, and it's not nearly the fit that your patients deserve. So you're thinking, well, that must be a lot of money. Well, I don't know what it really compares to your lab, because I have no idea how much your lab is charging you for this type of denture. Your lab can work with AvaDent to manufacture this. So your lab can do some of the simpler things like make a bite rim, or put the wax on a bite rim. But really, at the end of the day, the denture that AvaDent's going to make for you is going to fit better. There's going to be less adjustments. You're going to have greater patient satisfaction. And as a result of that, you're going to have less chair time. The amount of money you're going to make per denture is going to increase because the number of appointments has gone down, and the number of follow-up appointments has decreased dramatically. So again, I don't have a dog in the fight. I don't care if you use AvaDent or not. All I can tell you is the couple of days I spent at that company learning their techniques, the passion that they have towards making the most perfect ideal denture that can possibly be made for you is something it's certainly worth you looking into. So it's AvaDent.com, AvaDent. And you can mention my name, not that it's going to get you anything. It's not going to get you a discount, and God knows they're not paying me anything. I can promise you that. But I can tell you that the people that you're going to interact with there are just so amazing. And the technicians, and what I mean by technicians, I'm not talking about some lab guy, who's putting wax on a rim. I'm talking about the computer technicians that are going to help you. They know so much about dentistry, and they know so much about removable prosthetics that they're going to be able to help you make an amazing, perfect prosthesis. And not only are they able to do that with dentures, they can do it with overdentures, and overdentures with attachments that are on teeth, or they can do it overdentures that are on top of implants. They can make overdentures that are implant retained and tissue supported. They can make overdentures that are implant supported and implant retained. They can make hybrids. They can do all of this stuff using the techniques that they use. And the mesh that they put inside their dentures to give it strength is so clever and sophisticated. And then you can go to the website, you can see all this stuff. Don't listen to me necessarily. Discover it for yourself. You've got to try this denture technique. It is just truly amazing. It's going to transform it. So the things that I used to worry about so much, which was, seeing that patient on the schedule, and most of the time they were nice people, and they've got a sore spot, and I'm adjusting it, and I'm chasing sore spots, and then they're saying, I can't really chew that much, and I'm telling them to put glue underneath their denture to hold it in place. The glue that I was recommending would be so much more effective if the interface between the tissue and the prosthesis was so perfect that the amount of glue they needed was so super thin and the surface tension was so great that it would help hold that denture in place. The only way you improve the surface tension is to decrease the space between the prosthesis and the tissue. The only way that you can decrease that space is with digital dentistry and milling out a dental product out of a puck of acrylic. Go online, watch the videos. You're just going to say, wow, I didn't even know this existed. These people have truly, truly got it going on. So AvaDent, AvaDent.com, they will save all the aggravation you have making dentures, overdentures, implant retained overdentures, in the fixed prosthesis that you make when it comes to all on fours, all on fives, or all on sixes. You need to see this company. It's just amazing. Anyway, enjoy. That's my tip. You're going to love it. AvaDent, AvaDent.com. I have no association whatsoever as far as remuneration from that company. I wish I did. Anyway, enjoy. That's an amazing, amazing tip. You're going to love dentistry because of it. So this is Dr. William Balanoff, and this is Dentistry Goals. Thanks a lot.